This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome to Mon Health Talk. I'm Dave Wilson. Two guests joining us today as we'll talk about the new affiliation between Mon Health and Highland-Clarksburg Hospital. First of all, President and CEO of Mon Health, David Goldberg. Good morning, David.
Good morning, David. Happy Monday.
Happy Monday to you as well. And we also have CEO of Highland-Clarksburg Hospital, Vicki Jones. Good morning, Vicki.
Good morning.
Well, guys, thanks for taking a few minutes with us this morning. And I know I've spoken to both of you, obviously, David, many times, but I have to ask you a little bit about yourself before we dive into the subject. That's only fair because everybody has to go through it when they come on the show. So how about we start with you, Vicki? Just give us a little background about who you are, where you came from, and how you ended up with Highland-Clarksburg Hospital.
Well, I'm originally from Charleston, West Virginia. I was born and raised there. Moved to Morgantown about four and a half years ago. Prior to serving as the CEO for Highland-Clarksburg Hospital, most recently I served as the CEO for Mildred Mitchell Bateman Hospital in Huntington, West Virginia, and I also served as the role of commissioner for the Bureau for Behavioral Health in the West Virginia Department of Health and Human Resources.
Well, Vicki, what led you down this career path?
The role that I previously held included responsibilities for both inpatient and outpatient community-based behavioral health system, as well as inpatient behavioral health care in West Virginia. And during my tenure as both the commissioner and the CEO of a psychiatric hospital, I learned firsthand the behavioral health services in West Virginia and the surrounding states. After I retired from my previous job, my goal was to continue to work with individuals requiring behavioral health services, and this opportunity with Highland-Clarksburg Hospital has afforded me that to do so.
And, David, we've obviously had you on the show several times. I don't know if I've ever asked you the question, though, how you got started in this career and down this career path. So how did you end up where you are today?
Well, good morning. It's funny. I don't know if I've ever shared this story. So why am I in healthcare today? I'm a former Shriners kid. At age 7, my mother found that I had neck issues. I went to many pediatric hospitals around the country, and they found I had a benign tumor on my upper spine. That Shriners Hospital in Philadelphia was the only one who found it, removed it. Luckily, I'm here to tell the tale. But going through years and years of spinal issues, back pain issues, and then becoming passionate about healthcare. As a former fundraiser, getting into hospital operations in the early 2000s after a brief career in government. Another thing Vicki and I have in common. And here I am today in hospital operations decades later, and I believe it's a calling, and it's a way to give back to the community and make sure we provide for the health and wellness of those in our communities.
You know, David, that's amazing to me because there's so many of the physicians and nurses that we talk to in this program each week. When I ask that question, it's a similar story as to why they got into it. There was an injury and they met an orthopedist and it started them down that road, or family member was involved, but those stories are so similar that it really is evidence to that it's a calling and more than just a career choice.
I agree with you, and while we're on a calling, I want to do a special shout out, Dave, if I can.
Sure.
Last night, we had a terrible storm here in Morgantown, and Hazel's House of Hope, which I serve on the board. I want to do a shout out to Fire and Rescue. The school board by getting a vehicle to transport some of the people from Bartlett to temporary housing, to Mon EMS, to the board members and the community organizations at Hazel's House of Hope. Everyone deserves to get a shout out. It goes to show how special North Central West Virginia is. And last night the community got together to be able to help those in need, and that's what makes us so special here in the greater Morgantown.
In fact, we're going to spend quite a bit of time on that coming up in the next hour on Talk of the Town this morning. So last month, David, Mon Health and Highland-Clarksburg Hospital announced the affiliation agreement. Generally speaking, can you explain what this affiliation agreement is all about?
Yeah, very much like we did with Grafton City Hospital a little over 2 years ago and Mini Hamilton Health System a little less than a year ago. Highland-Clarksburg has a rich heritage and history of providing service to the community. Vicki, as you heard, and her team are outstanding. They needed a partner to help them with some infrastructure support. That's what we're going to do. They're a self-perpetuating organization. They have their own board of directors, their own clinicians, their own staff. That doesn't change with this, but it gives us the ability to partner on select areas where Highland-Clarksburg identifies we can help, like legal support, like information technology or computer system support, and others like that, while they still practice the art of medicine and the science of medicine for those with behavioral health issues, and we have infrastructure that we can lend to them, keep them stable, keep them going, and provide those excellent services the community knows of through Highland-Clarksburg.
And Vicki, what are the services that Highland-Clarksburg specializes in?
Highland-Clarksburg is currently licensed to serve 115 patients who require inpatient behavioral health services. This 115 beds includes 27 beds that are dedicated for our youth population. And we currently serve individuals who are required to receive this inpatient care through the involuntary commitment process.
And why was this affiliation agreement something that you felt would be advantageous to the hospital and the community there in Clarksburg?
We currently have about 300 employees here, and as a result of the pandemic, and like most hospitals, and I think that David would also agree that we've lost a lot of our staff, and we're looking for ways to not only maintain the hospital, but to expand our services. And so we believe that working in a health system, the Mon Health system specifically, will assist with our efforts to be able to recruit additional staff in the Clarksburg-area, but also surrounding areas. We'll be able to expand our hospital services, and we'll be able to meet what I believe is an unmet need for those in this area and really all across the state to receive these behavioral health services.
Our guest this morning, David Goldberg, President and CEO of Mon Health, Vicki Jones, CEO of Highland-Clarksburg Hospital. We got to squeeze in a quick break. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Talking to David Goldberg, President and CEO of Mon Health, and Vicki Jones, CEO of Highland-Clarksburg Hospital. David, and we're talking about the affiliation agreement that was announced last month between Mon Health and Highland-Clarksburg Hospital. David, how does Mon Health benefit from this agreement?
Well, I think you know and the community knows we have many more people who are presenting with emotional distress, anxiety, depression, other behavioral health issues. We see people coming through our emergency rooms. We see people entering our physician clinics with issues. So partnering and collaborating with the fine staff at Highland-Clarksburg gives us access to a deeper, richer bench of behavioral health experts to help those patients who either need services that are offered there or open up conduits and pathways to other programs in and around the community. I think we shared previously, we actually have what are called peer recovery coaches in all of our emergency rooms that help identify and coach people into pathways to help with their addiction. That's one thing we're doing, but to have access now to experts in behavioral health, psychiatrists, nurse practitioners who are experts in psychiatry that Highland-Clarksburg have only offers a deeper opportunity for those in the community needing those levels of services.
Vicki, over the last couple of years, certainly with the pandemic, and as we have started to, emerging from some of the stricter guidelines in the pandemic, have you seen more of a demand for mental health services?
we have seen an increase in demand for mental health services. And in addition to the mental health services, we've seen an increase in substance use disorders. And we are working within the Mon Health system, or will be working within the Mon Health system, to not only provide those behavioral health, mental health, substance use disorder, and other disorders, but also to merge those with the acute medical services that Mon Health provides, and so that full continuum of care will be provided between the two hospitals.
You know, David, we speak broadly when we're talking about whether it's the opioid epidemic or just the drug epidemic in general here in West Virginia, of having a holistic approach, and that includes everything from the substance abuse programs to the medical treatment to the support services. And I don't think I'm going too far on a limb here to say that what this affiliation between Mon Health and Clarksburg or Highland-Clarksburg here, that is part of the holistic approach, having that substance abuse program, having the mental health side of it, having the medical side of it, all working together there. This is a step in that direction.
Absolutely, Dave. I mean, we have so many different organizations in and around the greater community offering this type of service, and I call it the quilt of healthcare. Everyone's doing their little piece. I'm trying to build the comforter, where we bring everyone together, make it easier for the patient, easier for the providers to communicate and coordinate and transition people to the level of care where they need it. And I think this is another example of where we can go. We also know in our state there's a lot of need for pediatric mental health infrastructure. Highland-Clarksburg has the license and the ability to do it. And then in future collaborations with Secretary Crouch and the state and others, that's another area that we want to be a part of that journey to help all areas of our community with need.
Talking about the new affiliation agreement between Mon Health and Highland-Clarksburg Hospital. David, as far from a structural and organizational arrangement, does anything change for Mon Health or Highland-Clarksburg here?
No, not at all. Highland-Clarksburg's completely independent, own board, own license. They continue to operate as an independent hospital. We're just being, if you will, like a partner on the bench to lend resources, expertise, as Vicki identifies, and then partner on the clinical program, I think is the most important aspect. They're the experts. Behavioral health isn't one of the strongest services we provide. Now together, we have the opportunity to tap into each other.
David, is this a good thing for the healthcare industry as a whole, for to have these affiliation agreements and have these relationships between different hospitals who can provide different types of services?
I believe it is. There's only, money and resources are not infinite. So we need to be able to be very smart, be good stewards of our resources, and not duplicate just to duplicate. Here we have an expert like Highland-Clarksburg that can blend itself nicely with Mon Health programs, providers, and services, and we have infrastructure that can lend itself to be able to continue the shoring up and stability of Highland-Clarksburg. I think it's a win-win when good cultures come together with the end in mind, which is a stronger approach and a collaborative approach to lend itself to provide care.
Our guest this morning, President and CEO of Mon Health, David Goldberg, and CEO of Highland-Clarksburg Hospital, Vicki Jones. Will continue the conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Couple of minutes left with David Goldberg, President and CEO of Mon Health, and Vicki Jones, CEO of Highland-Clarksburg Hospital. We're discussing the new affiliation. Well, it's still new. New affiliation agreement between the two organizations that was announced last month. Vicki, what do you want people to take away from our conversation today about this new relationship and agreement between Mon Health and Highland-Clarksburg?
I would like for everyone to take away that Highland-Clarksburg Hospital is stronger within the Mon Health system, that we will have additional resources available to meet not only our needs, but our staff and as well as those we serve, the expertise to meet the acute care medical services that are needed. We'll have the ability to discharge to less restrictive environments as Mon Health operates a distinct outpatient unit, and we'll be able to manage our costs more effectively. So as David said previously, we believe this is a win-win for the hospital, for the health system, for the behavioral health system, and really for all of West Virginia.
David, same question to you. What do you want folks to take away?
You know, we have the best healthcare here in North Central West Virginia amongst all the providers. Here's another example of a stellar organization with outstanding staff and services, and we have to do our part to make sure they're stable, consistent, and available for those in need, and together we're stronger.
David Goldberg, President and CEO of Mon Health. Vicki Jones, CEO of Highland-Clarksburg Hospital. David, where can we go to find more information, if we would like, about the new affiliation and the services available?
Oh, absolutely. You can go to either one of our websites, monhealth.com. Vicki will be able to share hers. I don't have it in front of me. I actually cracked a molar last night during the storm, so I'm waiting to go into the dentist. Oh. So I'm going to be using yet another bit of healthcare here in North Central West Virginia to get myself fixed. But I'm excited about the future, and our community should be excited to know that they have access all across the board to the best healthcare available.
monhealth.com, Highland-Clarksburg-Hospital.com. Those are the two websites. Guys, thank you so much for taking some time with us this morning. Best of luck with the affiliation agreement and the future relationship there. Thank you so much.
Thank you, Dave. Thanks, Vicki.
Vicki Jones, CEO of Highland-Clarksburg Hospital, and David Goldberg, President and CEO of Mon Health, joining us here this morning. Again, that was announced last month. Mon Health and Highland-Clarksburg Hospital's new affiliation agreement. In fact, we have more at our website. If you go to wajr.com, you can read the story from that announcement.